Hello, my name is Jesper and welcome to this channel. In the previous videos, we talked about general heart failure as well as left-sided heart failure. In this video, I'm going to talk about right-sided heart failure, some etiologies, types, symptoms, diagnosis, and clinical picture. When we talked about left-sided heart failure, we said that an important term that we have to remember was backflow. And again, this is useful for us to note to understand why right-sided heart failure occurs, especially when we know and understand the basic anatomy and the circulation of the heart. The heart receives blood from both the superior and the inferior vena cava into the right atrium. Then the blood flows from the right atrium into the right ventricle. Then from the right ventricle, it goes via the pulmonary artery, carrying deoxygenated blood into the lung. And in the lung, it becomes oxygenated, and from there, it goes into the left atrium, traveling further to the left ventricle, and from the left ventricle, it's ejected out to the aorta, out to the body. Now, let's think about backflow. When the left side of the heart fails to pump sufficient blood out from the left ventricle into the aorta, then blood will back up, so it will flow back the opposite direction into the left atrium and then further up into the lung, backing up there, causing pulmonary disorders such as pulmonary hypertension and pulmonary edema, congestion. This again leads to the right side of the heart working against a higher pressure to be able to overcome this pressure to then pump the blood from the right ventricle, as we said, into the lungs. So this damages the right side of the heart, so we can say that the most frequent etiological reason for right-sided heart failure is already pre-existing left-sided heart failure, with then backflow and pulmonary involvement causing pulmonary hypertension, congestion, and then strenuous activity for the right side of the heart. Isolated right-sided heart failure can be seen in severe primary lung diseases such as primary pulmonary hypertension and sudden pulmonary embolism. In the case of right ventricular ischemia, due to some circulation problem, it may also develop. But as I previously stated, the most common reason is left-sided heart failure. We separate between acute and chronic right-sided heart failure. In acute right-sided heart failure, the onset is often spontaneous and the progression is rapid. In chronic right-sided heart failure, there is a slower progression and the onset is progressing slowly from compensatory mechanism such as pulmonary hypertension, since the right side of the heart must overcome a greater pressure to pump blood into the lungs. Symptoms. In comparison to left-sided heart failure, right-sided heart failure causes blood to back up into the vena cava. Here again, to know the symptoms, thinking backflow is important, because when the blood backs up from the right side of the heart back into the vena cava, it will cause peripheral symptoms. And a typical symptom we see is peripheral edema. So it can be seen as when you press a patient with right-sided heart failure's calf or leg on the bone, you can see a dent in the skin, which takes long time to return to its normal shape and texture. It may also sometimes cause ascites, and several organs may be affected and damaged. The liver might develop a so-called pathological process called nutmeg liver, and the spleen may enlarge, kidneys may be damaged, and frequently patients may have protein in the urine due to glomerular damage. A clinical symptom doctors can look for is especially dilated jugular veins in the neck, so-called neck vein distension. When we diagnose the patient, we look at the size of the heart to check for any potential dilation or hypertrophy of the right ventricle. We can use echocardiography or a standard chest X-ray. We also look for increased size in the vena cava superior and in the azygos vein, and we check for potential dilation of the right atrium. I made a table here quickly summarizing some of the key features and differences of right and left-sided heart failure. The backflow from the left side of the heart would follow the opposite path of the cardiac circulation, so back up into the left atrium and then in the lung. Hence it causes congestion of the lung. And on the other side, backflow from the right side of the heart causes backflow reversely into the large veins of the body and therefore causes peripheral congestion and edema. They both have the possibility to have organ involvement, but we separate between some different pathological processes. And in the right-sided heart failure, we often see hepatosplenomegaly, so enlargement of the liver and the spleen, peripheral edema and ascites. And in the left-sided heart failure, we can sometimes see induratio fusca pulmonum, dyspnea, exercise intolerance. The causes in left-sided heart failure differs. It's often caused by hypertension for a long time, valve disorders, arrhythmias, or even myocardial infarctions. The right-sided heart failure is often due to left-sided heart failure, as we said, but can also be due to primary pulmonary disorders or also valve disorders. That was it for this overview on right-sided heart failure. Thank you for watching, and I hope it helped. If it helped you out, I would be happy if you would subscribe so we can make more of these videos. Thank you for watching.